Welcome, everyone.
Hi, Jack.
We have just like our core group of volunteers in here today, which is really awesome. So we can have some nice, rich discussion. We have a few more people registered, so we might have people trickling in as we get started, but I thought we'd just kind of jump in and get going. So welcome to our virtual learning table, the first one of the year. Woohoo. And as you all here know, since we are all core volunteers or have been working with NAMI pretty closely, within the last a little bit over a year, we have expanded some of our services to reach West Marin, and we have our Friday family support group out in West Marin. And so we thought we'd invite West Marin Community Services to come teach us a little bit about what they do, just to have some more knowledge on our end about what we can refer people to out in West Marin. So in the tradition of our virtual learning tables, this will be an opportunity for our volunteers and whoever else might join us just to learn a little bit more about different organizations throughout the county and what services they offer. Today, we'll be focusing on West Marin Community Services, otherwise known as WMCS. So we have Seamus and Socorro here today to kind of just give us a little overview of what they do. And without further ado, I will give you the floor. Did you all want to try sharing your screen?
Socorro, you're still on mute.
Oh, here.
There you
go.
Yeah, and we would like to share. Do you want to share, Seamus, or you want me to share?
Go ahead. You can go ahead and get started, Socorro, and I'll once we get to my programs, I'll jump in.
Cool. Okay,
All right.
Stop sharing so you all can. Great.
Where's my document that I just opened?
Oh no.
If you okay, let me.
Yeah.
Okay. So, and I'm going to introduce myself and Seamus. If you want to do the same thing, I will really appreciate it. My name is Socorro. I'm the Executive Director of West Marin Community Services, and the office is located in Pond Station. And we serve all West Marin from north to south and towards the San Jerónimo Valley area as well. Seamus, do you want to introduce yourself?
Yeah, so I'm Seamus Tompkins. I'm one of the co-leads of our West Marin Community Response Team, which is you'll learn about in a little bit, a network of a county-funded initiative that's kind of a network of communications network that revolves around public health matters and disaster preparedness and response out in West Marin. And so I'll talk a little bit about my programs as we go forward. Socorro, there you go, the slides.
Yeah, the slideshow. So West Marin Community, as I said, West Marin Community Services situated in Pond Station. Our mission is to provide service and support programs and services that ensure the well-being of individuals and families in West Marin. Our values are self-sufficiency, human dignity, social justice. And the organization, let me go next. Okay, where I can hit next. I cannot see the arrow. Okay, let me see. Okay. West Marin Community Services is a central hub of services that support the neighbors in West Marin. We respond to ever-changing circumstances and act as the safety net to address needs unfulfilled by other organizations or government programs. This organization brings the community closer by building equity, fostering efficiency communication, and supporting community programs and projects. For more than 40 years, we have provided critical support in many ways, supplying food, clothing, and household items to families in need. We also provide financial assistance, emergency assistance, and approvals to county, state, and federal programs, and sponsor and offer many other programs and nonprofits. Here's a map of the area that we serve. As you can see, it's a very vast area from Dillon Beach to the north to Muir Beach on the south. And we cover Nicasio, San Geronimo, all this area. San Geronimo has its own food pantry, but many other services are provided through the whole West Marin. One of the main programs are the food pantry, financial assistance, youth services, Latino engagements, a community response team, thrift store, and special projects that we take on we're always working on special projects. We started one once in a while, and now it has become the norm for our organization. Who we serve: low-income families, seniors, unhoused, youth and children, disabled, and the West Marin immigrant community. Some stats, so you see who are the families who we serve. Income levels: 45% are very low, 52% low, and 3% to moderate or middle income. Our food pantry is open 5 days a week, Monday and Wednesday from 9 to 1 p.m. Tuesdays and Thursdays 12 to 4 p.m. The food pantry is sponsored by the main sponsor is Marin Community. One of the main sponsors, Marin Community Foundation. San Francisco Food Bank provides almost 80% of the food, extra food, born-raised farmstead, and local business and individual donors. Financial assistance: we support with rent assistance, energy bills, car repairs, dental and small medical bills. Emergency needs such as housing items, small house repairs, or other unexpected expenses that are not covered by any other programs or subsidized by government or local agencies. We also offer affordable youth services. We hosted an after-school program from 7 to 8 graders. It's open 5 days a week, 3 to 6, and we offer art class, cooking, mud biking, fishing trip, sports, DJ, and more. We also offer basketball camp, field trips, and swim lessons. We had a program called Latino Engagement and Empowerment. At the moment, during the pandemic, and currently it's been working at very low key, but we're working on revamping this program because we felt that it was extremely successful on the years that we were able to meet in person, and we wanted really bring it back because the community it's asking for it, and the board of directors through the strategic plan identified this program as one of the key programs that they would really like to continue offering to the community. And we do from personal empowering to, you see, we work on house and labor rights, education, support community events, and provide platforms, community conversation to address equity. We have the thrift store, and it's open 6 days a week, 10 a.m. to 5 p.m. And we use all recycles from the community. You know, it's mainly clothing and household items. And the profits of the thrift store support our programs, and we do childcare grants, individual financial assistance, and we cover from medical, housing, small repairs, and it depends on the request from community members. Supports the food pantry in the resource center, And we also offer free vouchers for families and individuals in need. We hand them out vouchers so they can go and shop for free. And this is the West Marin response team. Seamus can focus on this because he's been the coordinator of this program, very successfully run by him and a co-partner from San Geronimo Valley Community Center.
Yeah, so these community response teams, and we're co-leads of one of four in the county. So there's 4 different zones in the county that they establish these community response teams around areas where there's low healthy person index. And out here in our neck of the woods in West Marin, we are low on the healthy person index. So there was resources put into starting a West Marin community response team. So then there's 4 zones in Marin. There's one in the Novato area. There's one in the Canal District in San Rafael. South Marin has a zone, and then out in West Marin. And it's been an incredibly successful program in reaching community members. It came about in response to the pandemic. So early on the pandemic, when there was a great need to get out accurate and timely information, a lot of equity issues coming up, especially around access to tests and vaccines. And so our West Marin community response team played a huge role in helping coordinate vaccination sites and starting a testing distribution network, which has evolved into more than just those 2 things. It's evolved to provide, which I'll talk about in a moment, other resources in the community. For example, such as Narcan is something that we're now distributing through the West Marin community response team. So it's quite a robust network of agencies that are involved in our West Marin community response team. Everything from media like the radio, KWMR, Point Raised Light, to the schools, to the different food pantries. In fact, if you wanted, oh, actually, don't go to the next screen yet. So there's a local network coordination, and it's in conjunction with county HHS. And you can go back a screen there, Socorro.
Okay.
We'll get there in a moment. But yeah, so there's one of the really nice successful elements of the community response teams is made really good communications with with governmental agencies. Like example, in disasters, it's a lot easier to like share our needs up the food chain to Office of Emergency Management. And also if there's needs through public health, we have much better communication through our community response team with Health and Human Services. We've also started coordinating more in mental health services too, actually. So we've been coordinating with Marin County Behavioral Health and getting mental health first aid classes out here. So we have a couple coming up. There's one we're hosting in April, and then there's another location. San Geronimo will be hosting one in next month, I believe, and for the mental health first aid. And those are geared towards both youth and adults, both in English and Spanish. So we've been involved in helping coordinate that program and making sure those classes are accessible in West Marin. And so, yeah, a lot of different public health aspects have started, we started becoming communicators of in terms of services and resources through our community response team network. And so, and we continue to provide coordination, share information, public health messaging, and we're still helping in the coordination of vaccine efforts. One of our last couple of years, one of our big projects has been the health fairs in West Marin. So we've done a lot in trying to create equity of access of services in the public health sphere. And so one of the ways we've been able to do that, and I know AMI has been a part of our health fairs, is we put on 4 different health fairs in various parts of West Marin. As we saw from the map, it's a huge, geographically vast and sparsely populated areas, and so it takes concerted effort to make sure there's access to all different parts of West Marin, and so that's been a big focus of our community response team works. And the health fairs have been one big project of bringing a lot of those services together at one time, and giving communities access. We also have set up one of the ways we do a lot of outreach in the work we do is we've set up kind of a hub system in West Marin. because if you saw from the map, it's super vast geographical area, but there's different hubs where people will come to connect. And we've made those kind of the community centers, like our food pantries, and community centers, like Bolinas Community Center is one of our hubs, Inverness Fire Station, Tamales Town Hall, San Geronimo Valley Community Center, and us here at West Marin Community Services. 4 of those 5 places are food pantries. And all of them are community centers where people gather or seek information. And so we've made those, like, we've set up this kind of hub system in our equitable distribution of resources, and sometimes events and classes and things like that too. So we also have a promotores program, so with the Latino community, to help get out information in Spanish, and help promote our services or events, or public health messaging to the Spanish speaking communities. So one of our recent projects has been around, and you can go to the next slide if you want now, Socorro, Narcan distribution. So overdose is one of the leading cause of death in Marin County for under the age of 55. And so we've kind of, which is crazy, but we've set up in West Marin a distribution network very similar to the way we've distributed COVID tests, like at our food pantries and community centers. And we've also set up 24-hour boxes in various parts of West Marin, where people can access Narcan 24/7, because a lot of times it's going to be after hours where there's an overdose emergency. And we strategically put them in places. And you can see we have 5 up now in West Marin, and we're planning on putting in a few more. So people can get access easily in an emergency, or they can just take them on hand. We constantly restock them from the supplies we get from both the state and county. So that's kind of one of our latest project. In fact, one of an accomplishment I want to share, which is both kind of scary in one regard, but also incredible, is we know the Narcan we've been distributing in West Marin the last 8 months has gone into saving 5 lives that we know of.
Wow.
Which is pretty wild. So that's a little bit of the work I've been involved in. We've also kind of have done a lot of work in the disaster preparation space, and also in response as well, especially around those wraparound services. Like in this recent storm, we were very active in helping get information out about power outages, charging stations in the community, because we had some major power outages that extended for long periods of time out here. And so we've started to navigate a little bit in our community response team in the role of those wraparound service responses after kind of post disaster, not the initial like fighting fire and saving lives, but some of those needs that come up after a disaster that take precedence in the community where those needs come up. And a lot of the services that our agency and our partners are already involved in. So that's a little bit about the community response team work. And I know we've helped NAMI in promotion of some of the classes you posted out here, continue to host. And thanks for listening to us speak.
Thank you.
And Socorro, I can turn it back to you, Socorro, to wrap things up if you want.
Yes, and we also have other forms of supporting people in the community. We have our family emergency fund. We activate this fund every time that there is an emergency with a family. And those funds go to the families. We raise $1, that dollar goes straightforward to the families. This is with the goal of supporting the families who are going through very, very challenging times. We also facilitate communication between landlords, tenants, employees, and employees. We refer people to other services. We are not very public about this, but we offer transportation during emergencies. I give an example. When we learned that one family was on the street with 2 kids, there were Spanish speakers only, new arrivals, knew very, very little about the community. We managed to get funds to bus them to LA, where they had family members who will shelter them. And we paid the tickets for the bus, and we took them to the bus station and San Francisco, because we felt that it was an emergency that needed to be addressed right away. We also translate and interpreted for some events or families who need that services, and help the clients to complete documents when they don't have the ability to do so. And we take very seriously some of the our clients' cases, and it's something that is hard to reflect on all that we do, but we have clients who notice that time has passed and they are not available to get the resources they need by themselves, then we take an extra step and really pull a group of partners to make sure that all the needs for these clients are met. And that concludes our presentation. I don't know if you have any questions, or I'm open, and we are open for questions.
Thank you so much. It was really insightful to hear about all the different things that you all do. Talk about, it's really some wraparound services in a way. Yeah, go ahead, Lou.
I just wanted to give Jack a shout out for Seamus and Socorro, to notice that Jack is the one who's like really running our support group every Friday and driving out there. I
Sweet.
him a little when I
Nice.
can, but he's the lead on doing that. So, and that group, because as you guys know, your area is small geographically, it took us a good 6 months or more to get the support group up and going, but it's really great. And it is hybrid. So there's a couple people that Zoom in, but most of the people are present locally. And we've got an ad. Amanda's helped me keep an ad up in the newspaper there, and it seems like a lot of people come through that ad. So
Nice.
Oh, I'm so glad that's still continuing. Yeah, that's really great to hear.
yeah, it's ended up being a rich group.
Jack, you got your hand up?
Yeah, I have a question. The mobile crisis response team for the San Rafael area and more, Nevada and around, they deal mostly with mental health crises, and they all have mental health training, and they have the ability to force somebody into the hospital if necessary.
On like a 5150.
They also go around with police backup if that's necessary. And I wonder, I guess it's a question for you, Seamus, is that how you pronounce it?
Just like shameless, but without the L is the best way to.
Okay. Do any of the people, do you get called out on mental health emergencies? And if so, do you have any training in that area, the people that arrive?
We do not get calls on that, but we deal with very distressed clients. And I have the training myself, and I believe that at least one more staff member is something that we would like to continue doing, because this is a topic that I feel that it is never enough. You have to keep updating and reminding yourself. And one area that I don't know if you offer this, but I'm thinking about bringing someone to train us on how de-escalate, clients who are under a lot of stress. Instead of feeling, how we can de-escalate whatever they are going through, because I heard from the staff a lot that they're afraid that one day they are going to be physically attacked. And I believe that the key to avoid that is learn how to de-escalate the situation, trying to help them get it on a better place. And I don't know if you do that those kind of training.
So, and on my end, yes, I've gone through the mental health first aid training, which is I actually have found to have been helpful. The reality is, we're not the first responders for those calls, but we end up being first responders on many occasions because
Am I froze?
Oh, did I freeze? I didn't freeze, did I?
No, I
Still
don't
here?
think so.
Yeah.
Okay. We end up being in the middle of a lot of these situations because we are trusted in the community, and so people in crisis will end up kind of at our doorstep. It's happened to me, it's happened to some of our other staff, and so it's really important that we have those resources available, and we've had to talk to the mobile crisis folks unit in San Rafael before. Access to that out here, we don't have a local mobile crisis unit, which is it's a bit unfortunate.
Yeah.
And I hope at some point there'll be more of those kind of emergency crisis resources out here, because other than that, it's often the police that are the first responders in that situation, and that's not always the best for those in crisis, as you all probably know.
Yeah, we should definitely advocate with the county to try and, I know they're expanding their whole.
Yeah, and I know it is on Health and Human Services radar to have more of those. And we do work really closely with the care team, who also can respond. They operate in West Marin and can respond to those emergencies. But even so, there's times where it needs to be elevated beyond that, and kind of that those resources that exist in San Rafael have to come all the way out here, and they're not always available too. So it is one of those things that, I think advocating for more resources on that crisis response out here in West Marin would be valuable.
So if I get, there's some regulars in the family support group meeting out there that there's about 7 people that I've gotten to know over the months. And if they ask in the meeting, or ask me in particular, what do I do when, my loved one is in a psychiatric emergency, and if they say they don't feel safe, I tell them to call the police. But a little less than that, I suppose the mobile crisis response team from San Rafael can go out there if they have the time.
Yeah, and they have come out here before. Yeah, but there's a bandwidth issue. They not always can. And so, yeah, those particular situations can be tricky out here, and it's sometimes the police force that aren't necessarily trained per se on those issues, or sometimes.
Now, there was another question. I don't want to hog all the time here, but there was another question I wanted to ask. Do the police in West Marin, do you know if the police in West Marin are trained for psychiatric emergencies? Do they have CIT training?
I don't know, to be perfectly honest with you. And I know our local police we have a police force that is very friendly with the community, but we also have the kind of the state patrol, and then the local police force, and sometimes you don't know who's going to respond, and I honestly don't know if their level of training.
Okay.
Yeah, Flo.
All law enforcement are trained. That you're in the sheriff's department, not police, and each officer has received 16 hours of training in the CIT.
That's good to know.
And it's the law now, and it's been going on for a few years. Highway Patrol also, and they're trained, but it's not enough. 16 hours isn't enough. That's my complaint, and I complain to them all the time. They need more training, because sometimes they just don't handle it very well if you've had experience with them. And I agree with you. If someone's in crisis and you have to wait till the sheriff's department gets there, or even sometimes the fire department, what are you going to do during those 5 or 10 minutes? Because it can really escalate, as we all know. So maybe working with the county and getting some more training out there and learning some more tools, that would be really helpful for your safety as well as the clients. That's my own opinion.
Yeah, I've seen, like I said, the time I've been with this organization, and have seen people in crisis at our front door, I have, I've seen the response from police, I've seen the response from fire, I've seen the response from the care team, I've seen the response from our local HHS, and they all look a little bit different. And I wish there was a little bit of a tighter strategy around that here, because a response from the police might be triggering for some folks, or it might escalate rather than de-escalate the situation. If
Right.
so it's a tricky issue for West Marin.
It
I'm
is.
not gonna lie.
Yeah.
Yeah.
Everywhere, not just West Marin.
Yeah.
Okay. But I just want one more thing. All the services that you offer, you've really done a good job, whoever started this years ago, because 20 years ago, Marin Medical Reserve tried to get out there and do some organization, and I was part of that. And the community did not accept us at all. They said, we're farmers, we can take care of our own. And they didn't want people from the other side of the hill, so to speak, to come out and help them. So I congratulate all of you. You have some tremendous needed programs. And also I've heard that in Bolinas, for the homeless, you have showers there, which is really wonderful. Because
Every Wednesday. Yeah.
Yes, every Wednesday there's showers. And I think that's wonderful. And that's from the social workers that they started, the social workers out there. I think it's been about 2 years now. And I think Karen Gately was a big help in that.
No, she's a rock star. Yeah. Yeah.
Yes, she's really a very good social worker. So thank you.
It's funny. It's interesting that you mentioned the kind of like, we don't want kind of outsider help. That has been barriers I've in the community response team work,
Right.
especially because it was a county initiative. It was from there was definitely hurdles in gathering partners in a coalition.
Yes.
With those sentiments still existing in West Marin.
Yes.
But it does help when you start to get like results and then bring
Yes.
much needed and useful services, and people start to come around and then want to be part of it. So it can snowball in a positive direction. And that's true with some of our other programs out here too. But yeah, that sentiment does still pervasively exist in West Marin. And part of me can understand that a little bit, just because there's been a long history in Socorro, I probably can attest to this too, where we haven't gotten services we've needed from quote unquote over the hill, or from, or the county has kind of, we've kind of been ignored as a part of Marin County. And so I think that has helped in some of that sentiment.
And I believe that this community takes so much pride on what they do, and they want to do it by themselves. An example is when COVID appeared, within a week, we were inundated by phone calls and how can we support, what we can do, how we can do it, what can we do for the community. And I recall getting a phone call from the county letting us know that they were going to be allocating some funds for assistance to the community. And we already were giving money out, because the community outpoured the support to this families who were in need. We were able to take care of the community. And I believe that that's the sentiment that the entire community has, and the pride that they feel behind it, that sometimes prevent us from really reaching out to the rest of the county. Another aspect that I have experienced is also this lack of communication and lack of understanding the rural community, the rural needs. Very often when services are brought to West Marin, they're designed for the Central Marin population. and they design around the needs of that community.
Right.
And whatever they bring into this community doesn't match or doesn't work. And is when this mixed feelings get around. Oh, we did it, but no one showed up. And then locals will say, oh, they came, but they want to impose what they wanted to do, la, la, la. And I believe that that's, and I take some credit, and I feel that the CRT came to really debunk all those rumors and feelings, because I have put every time I have the opportunity, I share with nonprofits and the county offices that when they fund or when they ask for funding, they should be thinking about West Marin as a different identity and how we can support this community.
Right.
Because as you said, we have a lot of people who are very conservative still, and they wanted the farmers, they want to keep intact. They are very resistant to change. They really wanted to honor their way of doing business, the way they have done it for many years. And we have to respect that. But how we can kind of mingle those little pieces, how we can work around. And I believe that the beauty of the CRT was that we were collaborating with the county. We all agreed to send the same message, adapting it to each community and each CRT. And jump on the conversation, Seamus, and tell me if I'm
No, you're very on track. In fact, I'd love to give you an example of kind of this. So early on in the CRT's kind of evolution, like especially when the vaccinations were first rolling out, they were wanting to get them in West Marin, and they had set up an online system for registration for to make vaccination appointments, right? Locally in our, it was at the schools, at our food pantry here, but they wanted to do it as an online system for registering, which most of the rural, like there's connectivity issues, there's digital divide issues out here. And so what happened early on, especially when there was a great need, and many were seeking vaccinations, is folks from over the hill were booking those appointments and filling up all the slots for West Marin. So fortunately, and this is the way county and nonprofit really should work, is they were able to listen, take in our feedback, structure it completely different, so that those vaccination opportunities were geared for those one that had didn't have to like bridge a digital divide, like allow most of the spaces for walk-ins, places that were very community centric. And so we kind of redesigned the whole access to getting vaccinations in West Marin due to the needs here. And that was because of bilateral communication in the programs I worked with, which before then I think were a little less common, that kind of two-way communication. I know the community response team is that's one of the central pillars of it being so successful out here, is that that feedback loop, that positive feedback loop between county agencies and community needs, and what the nonprofits are saying, that we need X, Y, and Z, like they respond accordingly. So yeah,
finally.
Yeah, so it's been a nice success story that way. But
yeah, good job. Did a good job.
Yeah, it's really, really awesome to see all of that work coming together and communities being accepting of it out there, because I know that can be really challenging. But it's interesting. I feel like for me, growing up out in West Marin, I wouldn't necessarily think of West Marin as a place that you'd need to come with like culturally responsive behavior, but it's so important because it really is. It's like my partner and I were just joking about this. We're like, it's like a different country almost sometimes. Like just the norms are different and the way we do things is different. And
even in West Marin, the different villages feel like their own countries.
Yes.
Different packets of population that we serve. I we have the farming community,
Mhm.
we have the farm workers community, we have the business community,
Mhm.
and then we have the senior community and the liberals community plus the right wing community.
Right.
And I feel that we have to be very strategic, and especially when we're doing offering services that we know that will be sensitive, and COVID vaccinations and testing was one of those sensitive issues that we have to be very tactical on how to reach out to the entire community to really make at least will make them believe that it was important for us to be vaccinated. It was important for us to be tested. It was in the well-being of the community. It wasn't because we want to do any harm. You know, all those little pieces play a big role. And
Yeah.
the the promotores, another piece that we really have to have voices that were trusted to certain groups. In this case, the Latino community, they needed to hear from someone like them. You know, this is happening, come and do it. So really be strategic about how we reach out, and we have to be strategic for all the programs that we run, because we have different packets of populations that have different needs.
And just as a result of kind of this collaboration, like through the CRT, we ended up having some of the highest, Marin County in general, especially West Marin, ended up having some of the highest vaccination rates in the country,
Wow.
especially in those early vaccination rollouts.
Yeah.
And that was because it was community driven and like it was in response to the best ways to offer it to the community rather than a top-down approach. And I think that really paid dividends. And we ended up getting national recognition at the White House for it. So
It seems like we might have lost Amber. Well, so thank you so much for the presentation.
thank
I thought
you. This was fun. Yeah.
this was
Yeah.
super fun.
It's good.
It is our pleasure. And feel free to reach out, and especially the food pantry, we